Hello and namaste everyone. Welcome to the Nepal Nursing Licensure Examination Preparation Part 4, and in this video I'm going to discuss 10 questions, possibly with the rationale as well. I hope everybody will find information from this video. And we will begin with the question number 1. Question number 1 says that a client had a total thyroidectomy yesterday. The client is complaining of tingling around the mouth and in the fingers and toes. What would the nurse next action be? There are four options. Option A, obtain a crash card. Option B, check the calcium level. Option C, assess the draining for drainage. Option D, assess the blood pressure for hypertension. And first, let me explain you regarding the tingling sensation around the mouth and in the fingers and toe. Mostly this kind of sensations occur when there is low calcium level in our body. And for normal people also, they will be feeling like tingling sensation in the face, like twitching sensation, feeling like somebody is pulling their cheek from inside like that. And I hope now everybody have guessed the correct answer, that is to check the calcium level. And yes, the correct answer is option B. A nurse need to check the calcium level of the patient whenever the patient is complaining those kind of complaints. Now question number 2. A nurse is caring for a client admitted to the ER with DKA. And don't get confused with ER, that is definitely emergency, and DKA means diabetic ketoacidosis. And in the acute phase, the priority nursing action is to prepare to option A, administer regular insulin intravenously, administer 5% dextrose intravenously, and correct the acidosis, apply an electrocardiogram monitor. So here, let me explain you a rationale as well. Whenever the patient is suffering from diabetes, we never administer dextrose that contains glucose, because that is strongly not advisable to administer to the patient. And correcting the acidosis need to be done because the patient is suffering from ketoacidosis. And apply an electrocardiogram monitor. This is not really an important task to do in acute phase. So the correct answer will be option A, that is administer regular insulin intravenously, because lack of insulin is the primary cause of DKA. That's why treatment consists of insulin administration, that is regular insulin, and IV fluid administration of normal saline initially is important, and potassium replacement followed by correcting acidosis. And applying an electrocardiogram monitor is not a priority action in this phase. Now question number 3. Which of the following is the micronutrient? Option A, minerals. Option B, protein. Option C, fat. Option D, carbohydrate. And the correct answer is yes, that is minerals. And for your information and for revision as well, I have included a small information regarding macronutrients and micronutrients. I hope it will be really helpful for you. And under micronutrients, you can see that it includes fats, carbohydrates, protein, water, and fiber. And under micronutrients, it includes vitamins and minerals. Question number 4. According to World Health Organization, pregnant woman is considered anemic when her hemoglobin level is option A, below 11 mg per deciliter, option D, below 13 mg per deciliter, option C, below 14 mg per deciliter, and option D, below 15 mg per deciliter. And I hope everybody have got the correct answer, and the correct answer is option A, that is below 11 mg per deciliter. Now, question number 5. Which of the following chronic complication is associated with diabetes? Option A, retinopathy, neuropathy, and coronary artery disease. Option B, dizziness, dyspnea on exertion, and coronary artery disease. Option C, fatigue, nausea, vomiting, muscle weakness, and cardiac arrhythmias. Option D, leg ulcer, cerebral ischemic events, and pulmonary infarcts. And this question is really easy, and we everybody have studied the chronic complication of diabetic mellitus, that is retinopathy, neuropathy, and coronary artery disease. As well as you can see in the slide, there are two forms of complication present in diabetes mellitus, that is microvascular complication and macrovascular complications. And under macrovascular complications, there are complications such as retinopathy, which is related to the eye, nephropathy related to kidney, neuropathy related to the nerve. And under macrovascular complications, cerebrovascular disease, that is related to the brain, where there will be a risk of stroke, cardiovascular disease, risk of heart attack, and peripheral vascular disease, that is poor circulation to the limbs. That's why there is a high chance of gangrene present in the toes of a diabetic patient. And even whenever there is presence of any wound in diabetic patient, then the wound tends to be there for a long period of time, and there will be definitely delay wound healing. Now question number 6. Which of the following is the mechanical method of contraception? Option A, Norplant. Option B, oral contraceptive pills. Option C, IUCD. Option D, basal body temperature method. And I hope everybody have a clear understanding with the methods of contraception, because we have been studying these methods of contraception since our class 9, 10, and we might have studied in our nursing course as well. And the correct answer is IUCD. And even you can see the pictures of this IUCD, intrauterine contraceptive device. And here I have included a small information regarding IUD, like what it is. It is a small device wrapped in copper, which is placed inside the home by a medical practitioner. But in Nepal, medical practitioner might not need it whenever there is available of a skilled personnel to do this kind of procedure. And in Nepal, we call this IUD as copper tea as well in our local language. And how does it work actually? It releases copper ions which immobilize the sperm and makes it really hard for them to move around the home. That's why whenever the sperms are not able to reach the home, there won't be any fertilization occur inside the uterus, and it definitely prevents the pregnancy. And how effective is it? It is considered to be effective for 99%, and we can find many humans using this method as well, because it has a few really good advantages. And the advantages are one of the most effective contraceptive out there, and it can be kept in for up to 5 or 10 years depending on which you get, and it does not interrupt sex as well. But there are certain disadvantages as well. The disadvantages are it requires a medical practitioner for it to be inserted, and as well as to remove it also. And it does not protect against STIs, sexually transmitted infections, because only a barrier method can protect sexually transmitted infections. Like for the barrier method, the people can use the method such as condom, and that is only the way like by which they can protect themselves against this STD. Question number 7. A patient is with persistent dry cough, productive sputum, evening raised fever. He has been losing his weight as he does not like to eat anything. What you will do? There are options. Option A, glucose tolerance test. Option B, routine examination of urine and stool. Option C, sputum test for AFP. Option D, it is not necessary to do any type of test. So let me quickly explain you regarding such test. So glucose tolerance test is mostly done to identify blood glucose level present in our body, and that is mostly done to check the diabetic, mostly done to check for the diabetic patient. And option B, that is routine examination of urine and stool, is mostly done for the patient who have diarrhea or constipation or any other kind of bowel problems and worm infestations. And sputum test for AFV is done for the patient who are having cough and who has the symptoms of tuberculosis. And definitely you might have guessed the correct answer, and the correct answer is option C, that is a sputum test for acid fast bacillus to check the presence of tuberculosis infection in the patient. Now question number 8, which of the following diuretic is contraindicated for patient with heart failure whose potassium level is 5.3 milliequivalent per liter? And there are options: furosemide, spironolactone, hydrochlorothiazide, and mannitol. And the correct answer is spironolactone. And there is a high chance of questions to be present in exam related to this diuretic, heart disease, and so I strongly advise every candidates attending for the exam to study the notes related to this furosemide and all the disease condition related to cardiovascular disease. Now question number 9. A nurse ausculted breathing sound of a patient who is admitted in ER with acute asthma. Breathing sound commonly heard in patient with acute asthma is option A, crackle, option B, ronchi, option C, wheezing, option D, stridor. And I hope everybody have guessed the correct answer, and the correct answer is option C, that is wheezing. Now the last question of today's video, question number 10. Which of the following is the causative agent for a peptic ulcer? Options are Streptococcus, Trichomonas, Helicobacter pylori, physiological stress. So here the correct answer is option C, that is Helicobacter pylori. I hope everybody have guessed the correct answer, and thank you so much for watching this video till end, and I really wish every candidate best of luck for your exam. And if you need any help or any suggestions regarding exam or regarding any topic, then please let me know. You can just put your questions in the comment box. And finally, please do not forget to like the videos, because I'll get to know the many people are watching and it will encourage me to make more videos. And please don't forget to share to your friends as well, because this video can at least help a little for the candidate who are going to attend exam. Thank you everyone.